Hi there, Dr. Harris here. I came in on a Saturday because I couldn't wait to show you guys my Avant, my Somnomed Avant sleep appliance here. And for those of my patients who have one of these that they've gotten from our office, I want to show you how to use that. Of course, we like to go over how to use this when you come in for your delivery appointment, but in case you forget or you want a refresher, or if you want anything to refer to, or if you just want to see what these things are like before you get it, that's what this video is for. So this is it. It's got an upper tray and a lower tray. It's a soft, kind of a grippy material on the inside, and the outside is a kind of a hard polished acrylic. It's kind of shiny and smooth. It's connected together with a little strap called an advancement strap, and there's several of these, and depending on the length of strap, that will determine how far forward your lower jaw is advanced. So with this appliance, the idea is that we advance your lower jaw forward just slightly, just posturing it in a way that opens up your airway to diminish symptoms of sleep apnea. When you have sleep apnea, obstructive sleep apnea, the soft tissues in the back of your throat, including your soft palate and tongue, fall backward into your throat and actually close off your airway. So the studies are showing that it doesn't take very much advancement of your mandible to open that airway up. So I'm going to show you how we change these straps and when to do that. But first I'm going to show you how to put it in. What I like to do is I put in the lower tray first and then find the upper tray with my teeth and bite it into place. So I'll show you. Right, just like that. That's it. To get it out, I push up with my thumbs on the bottom and then pull down on the top with my fingers. So that's how you do it. It's very grippy and very snug when it's in place. When I first got this and started wearing it, I thought, boy, this is gonna be tough to get used to. It's not super comfortable, and I think mostly I was just aware that it was there, and during the night sometimes I would I just didn't feel comfortable because I had this thing in my mouth. But it didn't take very long before I was less aware of it, and after a few weeks I kind of ignored it, and obviously started to notice as time goes on more and more the difference in my sleeping patterns and how well I'm sleeping and how less I'm snoring, and how much energy and so forth that I have from not having quite as severe sleep apnea. So that's how that works. Now, when you take it out in the morning, obviously brush it with a toothbrush. Don't use toothpaste because toothpaste has abrasives in it that will dull the shine, and you don't want that. The other thing is denture cleaners. You don't want to overuse denture cleaners or mouthwash because that can also be harmful to the materials that this is made from. Denture cleaners are fine. I would follow the manufacturer's instructions, which is to do that for maybe 15 minutes twice a week. They actually come with these little samples of Som tabs, which is a good product, and again, 15 minutes twice a week. Other than that, I brush it with cold or lukewarm water and Dawn or Ivory dish soap, just a gentle, mild hand soap, and that's the best way to clean it. And then you want to store it in the little container that it comes with, and with either the lid partly off like that or off completely, just so that it can air dry, and that way it won't mold. Okay, and that's important. It also, I give my patients one of these as well. This is a morning repositioner device. When you first take that appliance out in the morning, your jaw is in a different position than what it normally is. And when you first bite down, you'll notice your back molars don't come together like they normally do. Don't be alarmed by that, that's normal. We want to avoid that being a permanent thing though, so it's important to use this repositioner to kind of help your jaw remember where it's supposed to be. During the night when your jaw is postured forward, the soft tissues kind of fill the space of your joint, and the circulation and blood flow kind of cause your joint to just kind of move a little bit out of its normal position. Which is often a more relaxed position, to be honest with you. But obviously for chewing, you need for your molars to come together. So what you do is you put this in, it's kind of a soft, squishy thing, and you grip down hard on it. I'm gonna show you. So I put that on my lower teeth. It's got two little bumps right here, and I just grip down kind of hard, like that, just kind of grip. And I hold it like that. You can see the muscles on my, you can see my muscles stand out because I grip it hard. Don't mean to spit. Anyway, you grip down hard on that for a few minutes, several times. And you know, in the mornings I'll spend 5 to 10 minutes on that, and my molars start to come together again. Sometimes it's they go right to place. Sometimes they take a little bit more. There are times when I just am in a hurry to get to the next thing, and I'll take that out, and my molars aren't quite coming together. But then within 15 minutes or half an hour, I'm noticing that my teeth are coming together just fine. So again, it's usually not a problem, but it's a very good habit to make a habit of using this. You clean it the same way and store it the same way in the little container with your appliance. It's a good habit to just use this, and so we prevent your jaw from moving in its position. That can happen. If it does, it's generally not too big of a problem and is far outweighed by the positives of getting better sleep. But if you do have that problem, please contact me, or if you're not one of my patients, please contact your dentist if you have one of these, and let us help you work through how to get your teeth to match up comfortably. And anyway, we're with you along the whole step, every step of the way. Now, I am on a 0 strap right here. If you look at the side right there, there's a little number, and this is the 0. That's normally what I start my patients on, is a 0 strap, meaning how far advanced they are. So as you advance forward further, you use the way you'll do that is by changing out these snaps, and they go all the way up to 8 and even to a -1 if you need to go the other way. But we start with a 0 usually. I haven't had any patients myself that have gone past a 1, 2, or 3. I'm still on a 0, and it seems to be adequate for now for me, although I might change. But right now, like I said, I'm doing fine. So generally, I recommend waiting a couple weeks with a 0 strap, and you might find that you're kind of getting used to it, that you're maybe snoring maybe your spouse says you're snoring a little bit less, but still snoring, but you feel like your jaw is comfortable and you want to move forward. So I'm going to show you how to take this out and advance to a 1. Okay, so you take the 2 trays and you move them like that, so that the strap is at a 90 degree to the lower lower plate there. When it's at 90 degrees like that, then you can pop this little strap off of its hinge, and you can drop it on the floor just like that. All right, now when it's off, you can see the strap is just hanging there. The strap won't really come out unless you pull it to the side, so the white part is in the clip. Once the white part is in the clip, then it can just snap right out. Okay, then you're going to reverse the process. You're going to get out your number 1 or your number 4 or 3 or whatever. I wouldn't go more than 1 at a time. I'm going to advance to a 1. So I'm going to get the 1 strap out, and I'm going to just put the white part in the clip and just do a little bit of pressure with my finger there, and it snaps in. Then I'm going to swivel it around there so it's swinging in the middle, and then I'm going to attach it to the lower tray, and that will only work if you're holding the strap 90 degrees to the tray. If you're holding it like that, then you can just pop it on with your finger, just like that, on both sides. And okay, for those of you that are watching really close, I put it on upside down. All right, let's do that again. So again, 90 degrees, pop it on, 90 degrees on the other side, pop it on, and there you go. Okay, there we go. Now it's back together. So we talked about storage, we talked about cleaning, we talked about the morning repositioner. I think I've covered everything. If you have any pain or problems wearing this, please give me a call. But after a good, like we say, a good college try for 2 or 3 weeks, you'll notice that you that the snugness and the presence in your mouth kind of diminishes as you get used to it, and you sleep great. You sleep well, and hopefully better. You know, obviously that's our goal, is to get you better sleep, get you more oxygen, get you more REM sleep and more deep sleep, so that you can replenish your mind and your body. And so there you have it. That's the Somnomed Avant. For those of you that have it, that's a little short video tutorial on how to use it. And hope you sleep well and keep brushing. Talk to you later. Bye.